Welcome to medical preparation precedes action because in the world of emergency medicine, there's no room for hesitation or confusion. When a life-threatening situation arises, every second counts, and the ability to act decisively is only possible when one has been thoroughly prepared. Nurses, doctors, and medical responders don't rise to the occasion. They fall to level of their training. It's not the moment of crisis that shapes the outcome, but the hours of unseen study, practice, and repetition beforehand. Knowing the names, dosages, uses, and side effects of emergency drugs isn't optional, it's essential. In the adrenaline-charged environment of a code blue or sudden arrest, there is no time to flip through books or search for protocols. The mind must instantly recall what the body must do. Just like a soldier sharpens their weapons before battle, the medical professional must master these tools long before the alarm sounds. The drug tray should not be a mystery, but a familiar map of action. Being calm under pressure doesn't come from natural talent. It comes from relentless preparation. The ability to move with purpose, confidence, and clarity is earned in quiet moments of study long before the chaos arrives. Emergency drugs are life-saving tools because they are specifically designed to intervene in the most critical and time-sensitive medical situations. In moments where the heart stops, the lungs fail, or the body begins to shut down, these medications become the frontline defense between life and death. They are not already treatments. They are immediate responses that can restore circulation, restart breathing, stabilize arrhythmias, and counteract deadly overdoses. Each drug carries specific mission: epinephrine to stimulate naloxone to reverse opioid toxicity, atropine to treat bradycardia, and amiodarone to control dangerous rhythms. Their effectiveness isn't theoretical. It's proven in real-time emergencies where their correct use changes outcomes instantly. To a trained professional, these drugs represent more than just names and dosages. They are powerful tools crafted for urgent intervention. They must be handled with precision and respect. Knowing the dose at the right time can bring a patient back from the brink. These drugs don't just serve the body, they serve the mission of the caregiver. Enable them to fulfill their calling to save lives under pressure. Every vial, every ampoule, every syringe is a chance to restore hope, to interrupt death, and to fight for life with skill and purpose. A knowledge must be immediate and intuitive because emergencies don't allow time for hesitation, searching, or second guessing. In a high-pressure moment, when a patient is crashing and seconds feel like hours, the mind must respond faster than fear. The information about emergency drugs, what they do, how much to give, when to give them, must be so deeply rooted in your memory that it flows without conscious effort. This kind of instinctive knowledge is not developed overnight. It is built through disciplined study, repeated exposure, and hands-on experience. When adrenaline floods the body and chaos fills the room, it's not the textbook you reach for, it's your training. Immediate and intuitive knowledge creates confidence. It allows you to remain focused, calm, and purposeful when everything around you feels unstable. It ensures that your hand moves to the right drug, your voice calls out the correct dose, and your decisions are rooted in precision, not panic. This level of readiness can only be achieved by making the information a part of who you are. It's not about cramming for a test, but conditioning your mind to react with clarity and speed in the most intense and critical situations. Each drug has a strategic role because every medical emergency presents a unique physiological challenge that requires a targeted response. No two situations are the same, and a one-size-fits-all approach can be dangerous. Emergency drugs are not interchangeable. They are precision tools, each crafted for a specific purpose and moment. Epinephrine, for instance, is used to stimulate the heart during cardiac arrest by increasing blood flow to vital organs. Atropine is used to counteract severe bradycardia, helping to speed up a dangerously slow heart rate. Amiodarone stabilizes irregular heart rhythms, while naloxone reverses the effects of opioid overdose almost instantly. Sodium bicarbonate corrects life-threatening acidosis, and furosemide helps manage fluid overload in patients with heart failure. These are not random medications thrown together. They are selected based on clinical evidence, response time, and physiological impact. Understanding the unique role of each drug allows healthcare professionals to build a logical and effective intervention plan in seconds. It also prevents medication errors, minimizes delays, and optimize patient outcomes. In the intensity of a life or death moment, knowing not just what each drug does, but why it's being used, transforms scattered action into strategic intervention. Every drug is a key, and the right key opens the door to life. You are called to be calm in chaos because when the room fills with panic and the unknown overwhelms everyone else, your presence is meant to anchor the atmosphere. As a medical professional, you are more than a responder. You are a stabilizer, a decision maker, and a bearer of hope in the most uncertain moments. The chaos of an emergency can shake even the strongest, but your preparation, your training, and your inner resolve make you a steady hand in the storm. Patients may be unconscious, family members may be weeping, alarms may be blaring, but your mind must remain clear, your voice must remain steady, and your actions must remain intentional. This calling isn't about just knowing what to do. It's about being who you were trained to become. It's in the way you call out for epinephrine with confidence, the way you perform CPR with relentless focus, and the way you lead a code with unwavering purpose. While others may freeze, you move forward. While others may doubt, you act with certainty. The strength doesn't come from titles or recognition. It comes from the quiet commitment to show up, stand firm, and serve even when the environment is unraveling around you. This is a mission, not just a profession, because the work done in emergency care goes beyond paychecks, schedules, and clinical routines. It's a sacred responsibility to step into moments where life and death meet, where every decision carries weight, and where your presence can mean the difference between tragedy and survival. You don't just show up to complete a shift. You show up because you've been entrusted with a purpose. The knowledge you carry, the hands you train, they see the strength of the instincts you sharpen. They're all part of something bigger than a job title. It's about serving people in their most vulnerable moments with compassion, urgency, and skill. You are not just pushing medications or performing protocols. You are answering a call to be a lifeline, a protector, and sometimes the only hope a patient has. This mission demands more than skill. It demands heart, grit, an unwavering commitment. It's what drives you to learn every emergency drug by heart, to rehearse every scenario, to stand in rooms filled with pressure and still bring peace. It's not about clocking in and out. It's about being present, prepared, and purposeful when someone's life depends on what you do in the next 30 seconds.